Hi everyone, my name is Sharita Gill and I am the behavior specialist for the Positive Behavior Interventions and Support Program for Family Central in Broward County. We are funded by the Children's Service Council and I am going to be talking about emotional and mental health needs of preschool children. So, we know that we're currently going through this pandemic and during our mandatory lockdown a few months ago, some routines were thrown off where children did not attend preschool. Some still attended preschool. Um, and you guys may be seeing some behaviors that are red flags, or you may be seeing an increase of, behaviors that you were already seeing. So, just to let you guys know that some of the slides, I am going to take my video off so that you guys can see the entire slide. Okay, so let's begin. Mental health needs. Jill Cook is the Assistant Director of ASCA, which is the American School Counselor Association, and she said mental health has to be a whole community conversation, not just before school starts, but it has to be something that's ongoing, where it brings together students so that they have an input. It brings together staff and the community groups that they are around in the community where they live. What is mental health? Mental health is the overall wellness of how you think, regulate feelings, and behave. Children's mental health. We need to talk about children's mental health. It is a touchy area, but we know that prevention is wonderful, and we also know that intervention can do so much more. Mental health disorders in children are generally defined as delays or disruptions in developing age-appropriate thinking, behaviors, social skills, or regulations of emotions. All right. So, our current pandemic. All right. So we know that COVID-19, it began in 2019 in China. It was declared a worldwide pandemic by March 2020. Public health emergency like pandemics take a toll on the physical as well as mental health of everyone. Children in particular, they're very vulnerable because they have limited understanding of the events that are going on around them. So although they see, adults not going to work, there may be a change in routine. They may not be able to see their neighbors or their friends that they used to play with. And it's very hard for them to put those things into words. They're unable to escape the harms of the situation physically and mentally as they have limited coping strategies. Closures of schools and separated from friends. This can cause a lot of stress and anxiety in children. Also, with the exposure to mass media coverage of the crisis, that can cause a lot of mental distress for adults, and it can cause mental stress for children as well. All right. So we hear this word going around that we have to social distance, when in reality, we're really physical distancing because we really want to keep social so that we are able to talk to someone if we feel lonely. We're able to express ourselves, stay in contact with loved ones that aren't able to leave their homes. According to the World Health Organization, companionship is essential for children's normal psychological development and well-being. Now, when we're physical distancing, it puts a space between yourself and other people. It is hard to connect physically. However, we can still connect socially and emotionally. So this time is a really good time to think positive, to start positive conversations, and keep those positive vibes going. Right. Parental stress. So we know that there has been a lot of stressors. As a mom of 4, I know it was a stressor for me where I had to work from home. And with them going to school online, it was okay, how do we find some type of routine where we all win? Now, for some parents, the parental stress is very high. Statistics from the University of Michigan during the first month of COVID, they said that 61% of parents have shouted, yelled, or screamed at their children at least once over the past 2 weeks since the lockdown began. Parents reported that they have high levels of psychological and physical punishment on children. Stable, supportive, and nurturing caregiver relationships offer young children fostering trust, positive social emotional development, and the capacity to form secure and strong relationships in the future. Unfortunately, social distancing can also cause child abuse, neglect, exploitation, and as providers, as preschool teachers, directors, we are mandatory reporters. Okay, so I want you guys to know that if you think it, report it. We are mandatory reporters. We are not investigators. So if you are in Florida, the abuse hotline is 1-800-96-ABUSE, 1-800-962-2873. All right, let's get to emotions and feelings. Right, so I want to introduce you guys to Dr. Joanne Luby. What makes Dr. Joanne Luby special is that she has done a lot of research on preschool children. She is a researcher at Washington University School of Medicine. She's also a child psychiatrist. She studied the brain of children over the past 2 decades, and what she has learned is that people thought that preschool children didn't have, much mental health concerns and that they couldn't get depressed. Nobody believed preschoolers could get depressed, says Luby. People generally assumed children under the age of 6 were too developmentally immature to experience the core emotions of depressions. So I'm here to tell you that all emotions are valid. These emotions that we feel, we need to understand them with empathy. The emotions that your children that are in your care feel, we have to let them know, hey, all emotions are welcome. However, not all behaviors are welcome. Emotion. So when we think of the word motion, we know that it's something that moves. An emotion is a biological state which is brought about by changes in the brain due to situations, thoughts, or other stimuli. There are various types of emotions, each of them having different intensities. Feelings. While emotions are associated with bodily reactions that are activated through the neurotransmitters and hormones that are released by the brain, feelings are the conscious experience of that emotional reaction. So here I wanted to show you guys just a spectrum of emotions. So we have negative feelings that are right here. I'll highlight for you. We have some negative feelings that are here, which are insecure, worried, afraid, guilty, embarrassed. We have the high arousal ones, which are the stress, burnout. Over here, I'll do my favorite color, it's green. We have the positive feelings over here, and Here we have enthusiastic, cheerful, satisfied, confident. So basically, when I think of whatever feeling that I'm feeling, I go to my first thought. What was my thought? So during the pandemic, I noticed that I was feeling a lot more anxious. I never really felt anxious before, but I noticed I was feeling a little bit more anxious than usual. And my thought was, I want to be as safe as possible going to the grocery store, and then safe when I come back to make sure that I haven't brought anything home. It was a scare where you're, spraying the grocery bags, and you're wiping down everything. So my thought was, I don't want to get my family sick. The feeling that I was feeling was anxious. I was, nervous, a little bit of anxiety, and my behavior in return was, I have to spray everything. I have to do, I have to wipe everything down. And I noticed I was getting very, very stressed. So I started going to the grocery store, and I started to change my thought pattern. And I said, you know what? I've done everything possible to protect myself. I have my mask. I've cleaned down, I've wiped my hands. I am still courteous to people at the grocery store. So I'm doing the best that I can. And I noticed that my anxious feelings started to go down. Right. Common feelings during quarantine. So I talked to you guys about some of the feelings that I had during quarantine, and we all have to realize that our children also have these feelings. Children are likely to be experiencing worry, anxiety, and fear. This can include the type of fears that are very similar to those experienced by adults, such as fear of dying, a fear of their relatives dying, or a fear of what it means to receive medical treatment. So schools have closed as a part of necessary measures. I mentioned earlier that when some schools closed, children were off their routines. They no longer had that sense of security, that structure, the environment that they were used to 5 days a week. They weren't able to see their friends. They weren't able to see their teachers. So for them, just like for us, a part of their social support was missing. And our social support is very essential for our mental health. Preschoolers learn through play. How can we, interact with them on a daily basis? They work through play. Understanding their emotions while they're playing and their responses, it can help address what they're feeling during this pandemic. All right, guys. So I spoke about my mental health. Now it is a mental health break. I want you guys to think about really how you have been feeling. Okay? How are you feeling? So, I have been working with children and families for over 20 years. And as a clinician, I sometimes fall back into the fine, where someone will ask me, hey, Sharita, how are you doing? Oh, I'm fine. I'm doing well. When in reality, I have so many things that are going on, but sometimes I'm like, you know what? I don't really have a connection with this person. I'm not sure if I want to open up, or there are times where I go back to the thought of, you know what? I've mentioned in the past before, like, I'm tired, I'm overwhelmed, I feel burnt out, and I don't get any type of like empathy from, let's say it could be from a friend or a coworker. So sometimes just saying fine is good enough. Sometimes People will say fine because they don't want you to feel uncomfortable with how they're feeling. They don't want you to feel sorry for them. I'm here to tell you guys that this is the time to be positive, to open up and say how you really are feeling with someone that you trust, someone that will listen to you, just like how we are trying to be there for the children, that we are caregivers of, that we see on a daily basis. Are they really fine? No. We have to be comfortable with emotions, because once we are able to label them, we are able to process them, and we can kind of get those negative emotions out of our bodies. Okay. What should we be asking our children? Same thing. We should be asking them how they're doing today. So I know a lot of preschools already ask children, how are you feeling today? How are you doing today? I encourage you guys, no time like the present. Start now. Do it every single day. Allow them to express themselves so that whatever stressors they're feeling, you can help guide them, or you can let their parents know, like, hey, such and such said this today. Have you heard this before? Due to the lasting effects of COVID, schools are going to have to address issues of race, anxiety, depression, abuse, trauma, grief. And grief and loss is something that I was talking to a colleague of mine a few months ago, and I told her, I said, I feel like I'm grieving on the go, because every day it is, I'm sorry for your loss, or I am, donating to a GoFundMe, or I am attending a Zoom funeral, whether it be COVID or natural causes. I just felt like I was just grieving on the go. And I said, I really have to take time to go through that grieving process. And the grieving process doesn't have to be a loss of an actual individual. It could be a loss of a job. It could be a loss of a relationship, a loss of a home, a loss of a car. People are, they're going through so many financial strains right now. So when they drop their child off, they're not going to go into detail and say, hey, this is what I'm going through. But in the car, the children may pick up on whatever type of energy, or, whatever is going on in the home. So also there are safety and food security. Maslow talks about his hierarchy of needs. At the bottom, we have safety and security. A lot of people didn't even have that. All right. So now we're going to get into how to spot distress in children. Mood changes. All right. We know that sometimes children can be moody. We know that some adults can be moody. Keep in mind that changes in mood and behaviors are expected during their normal, they're normal for children to adjust. Further on, I'm going to talk about when you notice that it's lasting a little bit longer than usual, for you guys to kind of take note of it, let the caregiver know, and also start referrals. Dysregulation. So children are experiencing more dysregulation than ever before. They have difficulty responding appropriately to emotions and ways to regulate them. So this is an example of dysregulation. Could be maybe let's take a 3-year-old classroom, 3-year-old, they're in the imaginary section center. One takes a toy from another. They start screaming, but that screaming is not a tantrum. It's more of a meltdown, where you're trying to help soothe that child, and that child is just, their emotions are dysregulated, where this is a child that they maybe play with all the time, and they exchange toys all the time, but lately, anything that's taken away from this child, they respond with either they're overly dramatic, or it could be something where their, excessive emotional response is just off the roof, or they're not, where a child would take something from them and they have no response. That is what dysregulation means. All right. And psychological distress in children. There are times when adults are unaware that children are experiencing overwhelming feelings. Children of all ages find it difficult to verbalize when they're experiencing distress, especially our preschool age children. As caregivers, we have to be in tune with their emotional as well as their behavioral cues so that we're better able to identify whatever potential problems are going on. Children tend to express this psychological distress, which an example is anxiety, fear, and sadness. They act out in different ways. Each child will behave differently. One child may regress, another child, you may notice some red flag behaviors. Some become silent, while others feel to express anger and hyperactivity. Caregivers, we have to be patient with children and understand their emotions. In order to do so, we have to understand our emotions as well. We have to be patient, overall, understanding. We have to know that anything after COVID now could be a response from that. Some other ways that children can show that they are distressed would be feeling sick. Distress can also be physical symptoms. These are the somatic symptoms that children will display, which are headaches, stomach aches, unexplained rashes. If medical reasons are ruled out, the child may benefit from working with a mental health professional. They can help identify whatever problems are going on with the child. They can help give strategies to you as preschool staff, for the families, and they can help with these overwhelming feelings of stress. For our program, what I do during an intake when I work with individual children is I have um, a scale of which is called the child behavior checklist. On the child behavior checklist, it has about 100 questions on there, and most of the questions they ask about internalizing issues that the child may be having, and then they have externalizing issues. So those externalizing issues would be actual behaviors that you can see with your eyes. The internalizing would be questions like, does child have a rash that is not due to any medical cause? Does child always complain about stomach issues? Um, and externalizing would be, is child aggressive? Does child get along with their friends? We have to also consider, when we're working with children, developmental delays. It's very important to remember that younger children, especially children with developmental delays, may not be able to tell us exactly how they're feeling. So us as adults, we have to monitor their behaviors. We have to note any major changes that they have, to look at whatever cues that they're telling us, behavioral cues, emotional cues, and how we can help these children. Behaviors over time. It's expected that many children will display some type of behaviors and these symptoms over time. So as a caregiver, we would like for you guys to look at some of these red flags and note, does it occur in groups more than a few symptoms at the same time? So is it during every transition? Is it during certain transitions? Is it in the morning time? Is it in the afternoon? Is it when too many children are around? Is it when a parent drops off? Is it when a parent picks up? Number two, repeated throughout the day and continue for many days or weeks. And Is it a symptom or behavior that prohibits their ability to participate in daily activities? Red flags. Some behaviors to watch for that might indicate that your child is struggling to cope with recent life changes will include increased irritability, disrupted sleep or too much sleep, bedwetting. Is it a child that was already potty trained and they're experiencing, some bedwetting issues at home or maybe during nap time? Is the child experiencing nightmares? Are they socially withdrawn? Do you notice more sadness or worry? Have you noticed any explosive anger? So with explosive anger, daily tantrums with aggression, disruptive, destructive behavior. Are they ripping the classroom apart? Are they throwing chairs? Are there other signs of like intensity? Is it, that dysregulation that we spoke about? Increased tearfulness. Have you seen the child, do they cry more often? Is it something where now when they cry, it takes a longer time for them to self-regulate or for you to help them self-regulate? Are they clingy? Are they dependent on your behaviors? Do they follow you around the classroom? Have you noticed any, separation anxiety from parents? Are they being afraid of left alone? Is there changes in their eating? And earlier we talked about the somatic complaints, the psychosomatic, which are the headaches, the stomach aches, the unexplained rash. Take for instance, if a child has eczema, has their eczema increased? Because we know that stress can increase a lot of these functions, these somatic symptoms in our bodies. Do they have difficulty paying attention? Do they have difficulty concentrating? Do they feel hopelessness? And if they do, has it been 2 or more weeks? Have you noticed that there's a strong focus on death, dying, or the concern of a family member, something happening to them? Because we know that a lot of parents and staff have been attending many Zoom funerals or have, like I said, been saying rest in peace to a lot of people. Our children are aware of what we are watching. We may not think that they see, but they do see when we're sad. They see when we're tired, we're frustrated, we're angry, anxious. So as preschool staff, community, how can we help? Ways caregivers can help. So we can create opportunities for children to feel safe. Do this for the whole entire day. Find ways to create those opportunities to feel safe. My 6-year-old, for her to feel safe, she has to come over and give my husband and I a hug. So we know that that is her input. She needs that. So she comes over, she gets that, and that she feels safe. Look at the children that are in your care. What are some ways that you can create them feeling safe? What connections do you have with them? With our positive behavior support program, in some of the schools that we've been in, we've talked to you guys about the Safe Place, which is from Conscious Discipline from Dr. Becky Bailey. Next, we have Listen. Give children opportunities to talk about what they're feeling. Encourage them to share their concerns and ask questions. I know as an adult, I really like when people listen to me, and I know children, they also like when people listen to them. Create those opportunities to listen, create those opportunities for having them, feel safe. Acknowledge how they're feeling. How can we do that? We can acknowledge how they're feeling by doing something called noticing, which also comes a term that comes from conscious discipline. So you notice that a child, their face could be like this. and their body is slumped like this. So you can notice and say, hey, Sharita, I noticed that your face is like this. Are you feeling sad? I noticed that your body is humped over like this, you know? So with that noticing, you're acknowledging how that child feels. And children, they are very quick to let you know, no, I'm not feeling sad. I'm very angry. Or, you can help them with those feeling words. Comfort. Use tools that will help comfort and calm children. In the history of calm, has no one calmed down by saying calm down. So we know we have these calming strategies. So for preventative services, we want to show them what calming tools are in case they need them, because they will need them, just like how as adults we need our calming tools. Some of the common tools that you guys have used and can continue to use are stories. They can be social stories that you create yourself. There are many social stories on challengingbehavior.org website. You can type in preschool social stories on Google. A lot of social stories will come up there. Conscious Discipline has a lot of social stories. Paths, positive behavior support, which I just mentioned. You guys can sing songs, play games, because we know that children learn through play. And then we have reassure and praise. Let children know that you'll help keep them safe, of course. Focus on their strengths and praise them. Good job. And when we are praising, we want it to be a descriptive praise. Good job. You shared your feelings today. Thank you for sharing. Validating feelings. Now, earlier I talked about when people would ask me, Sharita, how are you doing? And I would just say, fine, because sometimes I felt, you know what, maybe my feelings weren't validated. And I mentioned to you guys that there are some people that I may not have had a trusting relationship with. In order for people to want to talk and open up with you, you're going to have to build that trusting relationship, build in the relationships, which if you're a part of our positive behavior interventions program, we have that pyramid model, and building relationships is a part of that first tier. Personalized help. The help doesn't have to be all of, the classroom. Personalize that help so that that child can feel, validated. Express the child's concern. Let children know that what they're feeling is okay. What you're feeling is okay. Allow them to take the lead and talk. When children are talking, we don't want to interrupt them. This is the time that we are going to listen. This is the time that we are going to work on building that relationship and validating their feelings. Modeling behaviors. Us as caregivers, we play a big role in helping children cope with stressful events. By modeling appropriate coping skills, parents like myself, caregivers, guardians, we can establish the standards for kids. These behaviors that we can model include taking a deep breath throughout the day, limiting social media use, connecting virtually with friends and family, scheduling preferred activities daily, taking a walk or doing some type of vigorous physical activity, practicing muscle relaxation techniques. So I want you guys to think about what are some ways that you've modeled behaviors for the children that are in your care. Are they positive? Are they not so positive? Do you have to kind of switch it up a little bit for each child? But be mindful of the behaviors that you are modeling for children, because they're always looking and they're always listening. Interventions. Some interventions that you guys are currently doing would be getting more stories about COVID, scripted stories, letting them know, hey, the reason why we have to wear a mask is to protect ourselves. You may have a different hand washing routine. You may be singing a different song to how they wash their hands and how long they wash their hands. You may let them know, before we used to sit on the carpet really close together during circle time. Now we have to spread out. So you're going to give them different interventions so that it can help them to better communicate and address their fears, their concerns. You're going to encourage routines, these physical activities, so that children do not feel, that pressure. School staff members need to look after their own mental health needs, coping strategies, so that you are able to model positive psychological attitude in order to support children to get through this difficult time. Right. Here are some other images I wanted to show you guys where, when we're talking about emotions, we want children to actually see real feeling faces. Of course, you can use the clip art for VPK and above, maybe, or even with the 3-year-old classroom and above. For infants, 1s and 2s, we recommend that you use real feeling faces. You can also take pictures of the children and use in the classroom. Let's see. So here we have a problem-solving solution kit, a safe place area in the corner of a classroom where children can go and they can problem solve, because we want children to be able to think, and we want not to teach them what to think, but they have to know how to think, which is a skill that they'll take with them for the rest of their lives. Here are a few books. Glad Monster, we have The Way I Feel. There are tons of books that are at libraries. There are tons of books that are on Amazon that talk about emotions, that talk about feelings, that talk about, some are age appropriate, where you can read to see, is this for a preschool age? Is it for a 2-year-old classroom, a 3-year-old classroom? Over here, we have Conscious Discipline, the safe place. You have the feeling puppets over here. Safe place is not a timeout corner. It is a place where that child can go to try to self-regulate. They don't have to be angry to go to the safe place. Here we have a write-in center. It has the calm down toolkit. It may have a stress ball in there. It has crayons, pencils, something for children to write their feelings down, or just, they could write a letter to their friend. Here you have the feeling faces. You may have sensory balls there. You may have like a sensory globe, sensory bottle. Concerns. If you have any concerns of any of the red flags that I noted earlier, address your concerns with the child's primary caregivers. However, never diagnose the child. I know sometimes we want to say, well, I believe that, Theodore is ADHD or something like that. We never want to diagnose a child. What you can say is, I've noticed that he's been a little hyper, more than usual. I've noticed that in the morning time, it takes a while for him to calm down. And you want to just state what you see, not what diagnosis you think that child is. Which leads to describe the behaviors that concern you. What are the behaviors that you see? Do you see behaviors of the child just sits in the corner and he doesn't want to interact, or she doesn't want to interact with her friends? Do you see more aggression? Do you see more irritability? Suggest that they talk to their child's doctor if it's something that is very concerning and it's something that has been ongoing since they've returned to school. Refer to local mental health services, which may be able to help with psychotherapy. And psychotherapy is just talk therapy. The therapist may be able to do play therapy, art therapy, music therapy, whatever, appeals to that child. Family counseling. Family counseling is amazing. psychoeducation programs, parenting classes in order to support the child and their family. So a type of therapy that the child may go through could be, let's see, so we have cognitive behavior therapy. So cognitive, we know, our thinking. Cognitive behavior therapy, it assists the child in changing their thought pattern so that they do not internalize what is happening. Within cognitive behavior therapy, therapists, we focus on the resilience. Look what you can do. It's more of yay, being that cheerleader for that child. Some other local resources that you guys can reach out to is Broward 211. You can dial 211 from your phone. You can go on the website, which is 211-broward.org. Contact the 211 Family Services team by phone or on the website. If you have any questions, you have any concerns, or you want education about your child's development, if your child needs specialized services for mental health or special needs services, they offer all those supports on there. So I use 211 a lot because if a parent, a friend, anyone contacts me and they say, hey, what are some local things, rent assistance, electricity assistance, utility assistance, where can I go? I always refer them to 211. So guys, take advantage of that. And I would like to thank you for spending time with me today. I really appreciate it. Again, I am Sharita Gale with Family Central, and we are funded by the Children's Service Council. Thank you. Here, you guys, we have a few resources that I used in the presentation today. And I just, again, want to encourage you to look for those social cues, look for those emotional cues, look for those behavioral cues that our children are showing us. Take care of yourself first so that you are able to take care of others.